you know, I mean, we're making a little fun of this, but you start to see that anybody's mind could begin to go, I've done that. And you're, as a professional, looking there going, that's not what I meant. Well, it said on there, and you know, so if it's 4 times a day, is that equal? Am I supposed to divide 24 by that and get up in the middle of the night when the 6th hour? What am I supposed to do? And this one, here you go, folks. How many of you meet this? You're fully proficient if you can calculate an employee's share of health insurance costs for a year using a table. I can read down here, I can figure which one is me, I can read across, and I can go in there for this. That's a real challenge. All of these are things we're supposed to do, right? But do you see, it's not simple to measure that. And you could have a lot of theme and variation depending on how many people are even comfortable reading a table, period. Never mind whether it has anything to do with insurance or not, which happens to be rather more complex. So what is health literacy? Well, first of all, the black and white words are the words from the Institute of Medicine. This is their definition. And 3 years ago, when they recruited me to do this, being naive, not knowing much about the health area, but being an adult educator, I said, okay, the degree to which they have a capacity. So how do you measure capacity? The capacity to what? To obtain, process, and understand basic health information and the services needed to make appropriate decisions. Does that mean I'm health literate yet? Can I actually do anything? I thought I was supposed to act upon this. So I can know everything. I can pass a test and ace it, but I can't translate it into my life. Is that really a health literate person? So here I am. I don't even know much about the Institute of Medicine going, I'm not too sure about that definition. Well, the good thing is that definition kind of is in flux now because people are realizing it really doesn't fully encompass functional health literacy. So when I talk to a lot of folks, I just say it's how easily consumers can get, understand, and use information to live well. And then I usually do ... and do it. So how easily they can get it, understand, act upon it, and they do. I want you to notice that it is more complex than reading, and this is my visual for that. This is what almost everyone says when they talk about literacy. It's the ability to read and or to write, and that's the end of that. But when you start to look at this, you see it's much more than print literacy. I'm going to go to oral literacy over here. How do I speak so you understand what it is I'm trying to tell you about my situation? And how skilled am I at listening and decoding and understanding what you've said? The other day I encountered someone, I believe of East Indian descent, who was taking an order of mine and said it so fast and with a different emphasis that I was having difficulty understanding. And I said, would you please say that again? And he said it again, just as fast, louder. He said it a third time, very loud, to where everybody there turned and looked at me, and I understood it far less the louder he got. Because volume didn't help me, you know? And I said, could you say that more slowly? And when he slowed down, oh, that's what you wanted to know. Sure. And then I could respond, you know, and the look he gave me back like, well, what was your problem? And how many people get treated that way because you're in a hurry and you're trying to figure some of that out. So oral literacy is this component. Cultural and conceptual knowledge has to do with the backgrounds you come from. So like remember, I'm talking about people that are moving in from other parts of the country, from other parts of the world, and their sense of what health is or is not, or injury, or accident, or all kinds of things could be very different. Now, I was raised in a rural part of Missouri, and we self-doctored. I saw a doctor for the first time when I was 16, and Mother said I was grown up now and I needed to see one. By the way, the second time I saw him, he says, you're so much more tense now. I said, now I know. I say that to people, and people are almost like, oh my gosh, what kind of life did you live? Well, Everyone in the family knew pretty much how to deal with almost every kind of injury. We knew what kind of plant to put on something to take out stings. You know, we had a pretty good idea what you did for what we didn't know was called bronchitis necessarily, but you know, you had this in your chest and what you breathed and all of that. And most people, most of the time, got by pretty well. Our family is probably better educated than some, so I am not saying that all rural people, following their indigenous knowledge, are as healthy as they could be. No, in fact, rural people are equal to or worse than inner city urban areas. And that really shocks people here in the state of Maryland. I happen to, in full disclosure here, because I study rural, but I'm also the chair of the Rural Maryland Council. And I work on health issues across the state, and most people don't realize the poor health that's out in the rural areas, and particularly around asthma. Oh, all that great fresh air. Mm-hmm. Right, yes. Great fresh air, right. Okay. The other piece over here is numeracy, and this is almost never mentioned as a part of health literacy, but this is really a vital part when it comes to a lot of your prescriptions. Take a nutrition label. You're supposed to read this label, supposed to calculate if there's 4 servings in there, how big is a serving, how much can I have, and oh, if I have to control for fat and it has this many grams of fat, how much is that? That's complex. And so this numeracy is really important. And so in part, to answer your question about the breadth and depth of it, I'm doing this very quickly, but it's much more complex than to say, can we just write it at a 3rd grade level and will that be adequate? Because you might write it at a 3rd grade level and it would be adequate if I'm reading there at that point, but I may not get it, conceptual understanding, because of what it means. It's the meaning behind it that might be different. Same word, different meaning, we're no longer communicating. Another word I've never heard about, no longer communicating. So the challenge we have are that the literacy demands exceed our literacy skills, and what we're trying to do is to fill that gap. At the same time that I am probably emphasizing the individual consumer, I now want to shift and say the same thing is true of health providers. Your level of health literacy, when it comes to understanding a breadth of things, including adult learning, may not be where it needs to be. And so if we put it all on the individual, and if those people will just listen to me while I make it perfectly clear, you know, but not so it's not necessarily they're listening to you. It may be what it is that you're saying and how you're saying it. So there's if we did actual workshop, which we're not really doing this afternoon, we could really get into a lot of those kinds of techniques, some of which you're using and you can teach each other, and other of which you're not. But I just want to make that point, that it's not about those people. We have looked around, and it is us. Where did it go?
Where did it go? The space bar. I think it projected.
Power,
I think it
stand by and project.
Okay, who's in here to help me with this? Because we get that machine to talk to this machine, right? There's a literacy there to that, right? Those books, by the way, if you go to the Institute for Healthcare Advancement, you'll find those books. They're very well researched, and studies have shown over and over again the reduction in emergency department use among the mothers primarily who are using this book, who were taught how to use it. And it has sort of decision guidelines, right? Not like you and I might say, but they're in there to help you figure this out. And then they know better about what to do to prevent going to that. It just quit on me.
It's too high.
It's too high.
It's been on too long. It just gave up. We can try to get another one and see what we can
Okay,
do.
all right. So yes, and that's a good example of where the researchers worked with practitioners and worked with the people of the community to create it, and now it's a very effective tool. Okay, while they're working with that, I'm going to break up what we were going to do. How's that? Okay? No more of the lecture. That must have been the sign from above. Bonnie, shift this over to something else. All right, I would like for you to pair up with someone you don't work with. All right, so and move around and find somebody you don't work with, because I'm going to give you an assignment. You don't know each other. Okay, but there's to be two. Pair is two. So you have three. Okay. And there's two. And let's see. Will one of you join this lady, please? Okay. Your assignment is to explain all the possible steps or actions someone would need to take to accomplish a task. And I'm going to give you the task. All right? And I would normally probably have broken you up into different tasks, but for the purposes of this, I think we'll just move right along. All right? Your task, should you choose to accept it. Your task is to apply for Medicare for the first time.
Medicare.
Medicare.
Medicare 65.
Medicare. Medicare. Yes. So what are all the steps that you're going to need to go through? So together, the two of you work on this. We're going to do it fairly quickly. This is not definitive, but I want you to work on it. You're about ready. You're about ready to turn
65.
65 is when it is. Yes, you're coming up upon that, and it's a key decision-making time.
Okay, I'm not getting this.
What? That's because she's too young.
I mean, am I a practitioner or is she?
No, you're an individual person.
You're a person.
Oh.
You're a person. You're coming upon being eligible for Medicare.
Mm-hmm.
And the two of you are working together to figure this out.
Did you want us to write the steps to it?
Yes. Write the steps.
Yeah, you have to apply for Social Security. Yeah, I think so. And then after you apply for Social Security, somewhere down in the process, the Medicare kicks